Hello, good evening, friends. Welcome to yet another exciting episode of APEC Dialogue India Fights Corona. APEC Dialogue India Fights Corona aims to bring the best of the healthcare experts, doctors for this dialogue so that we can spread the message of positivity even when the chips are down during the pandemic. We're getting the top healthcare experts from the country so that they can talk about various subjects related to their healthcare problems, but at the same time, how to overcome those problems, especially keeping in mind this pandemic and the new world order. And tonight, we have a special guest with us. We have Dr. Ajay Bhalla, Director and Head of Department Gastroenterology, Fortis, Noida. Thank you so much, Dr. Bhalla, for joining us tonight.
Thank you so much, Savik, for inviting me.
Pleasure is all ours. My first question to you will be, Dr. Bhalla, that you are handling too many patients, and I know you're quite busy every day. A lot of patients coming to you. What are the main problems you're facing? What kind of problems patients are facing when they're coming to you during this pandemic? What is your observation on that?
Well, COVID, when it started last year in the first wave, everybody had this knowledge that having fever, cough, sore throat,
I think there's some audio problem with Dr. Bhalla.
okay, can you hear me now?
Now we can hear you. Yeah, please carry on.
Here, the main thing was the crux was people knew that fever, sore throat, or there was shortness of breath or breathlessness. If they came in, that means COVID was a thought which was there. But what was not seen earlier and what was seen in China and other countries was there were also other symptoms. Now, in this second wave, we have seen this other array of symptoms. They have people who come with only fatigue, headache, and body ache with some fever. And then there's a huge group of patients with gastrointestinal symptoms. They come with poor appetite, pain abdomen, nausea, and loose stools. Loose stools really being very predominant. And what we can see is now one third of the patients do present with GI symptoms. And these GI symptoms actually antedate these symptoms of respiratory tract, cough, and fever, which means they occur maybe 3 to 5 days before the onset of the actual disease. So this could be a early indication to diagnose. So that's what is the current scene, what I am seeing now in COVID, what all gastroenterologists and physicians are seeing, that we are seeing a lot of loose motions, anorexia, pain abdomen, nausea, vomiting, which could be there independent of fever, cough, and shortness of breath. Or they could be having only this. It was seen in China that almost 10% of patients do not even have any respiratory symptoms, only a GI symptoms which could be there. And this is something which, could be of great value because it is seen that those who have GI symptoms tend to have a more severe disease and they tend to have a more prolonged course. So that's where, if you found the second wave has hit us with this kind of symptom.
So, are you trying to say that this second wave is actually causing this GI symptom, which is much more severe compared to the first wave? And who knows, maybe that everybody is predicting the third wave will come to India as well. So, are you trying to suggest that, or trying to indicate that we have to be more cautious that if we have some kind of problems or the hint of problems which we have mentioned right now, we should not wait. We should simply go to a doctor or hospital. Are you suggesting that?
I'm trying to suggest that now we have something new which is there, which we are noticing, and we should be able to pick it up because this may antedate these symptoms of cough, respiratory distress, breathlessness. So you can pick up the disease earlier, hence you can kind of mitigate the problem earlier. So that's what we are seeing. This probably is new, and this, as I said, it could be causing a more severe disease. It has been seen that those who have GI symptoms, you'll be surprised, tend to keep shedding their virus for 2 to 3 weeks longer than those who do not have GI symptoms. It's like,
Right.
you check their COVID RT-PCR, that is positive for a period of 2 to 3 weeks longer than those who do not have diarrhea as a symptom.
So this is quite an insight because, and that's why this APEC Dialogue India Fights Corona special series has been created so that
I,
the
I
best
would
of the knowledge from the doctor fraternity comes
advise,
in this platform, and share their point of view so that the general mass can be aware of what are the problems are arising from this situation. Uh, what
I
is the major?
one more topic. I want to add one more thing. I won't be
Yeah.
surprised very soon. They may also start screening what is called a rectal swab for COVID. Rectal swab for COVID can tell you whether the virus is there or not. And that could be a policymaker in isolation places. Instead of doing a COVID through the nasopharynx, they could be doing a rectal swab because that could be a reason, another way of actually preventing the disease. So that could be a policy ahead, later ahead in future. Let's wait and see how it goes.
I'm sure that a lot of policymakers across India, be it government of India or state governments, are watching this broadcast and they'll be taking note of this very important point raised by you. Dr. Bhalla, if I may come to the uh, other side of the coin, that is, these are the problems which we discussed. But if we come to the other side of the coin, the flip side of the coin, that is how you're suggesting your patients that to keep calm, keep cool. Okay, this disease is there, but how you're helping your patients to overcome this pandemic, especially when most of us, the citizens, are mentally stressed at as well.
Uh, I'll tell you, there have been uh, guidelines which have been laid down by every healthcare provider. When I say healthcare provider, these are private healthcare providers. I'm with Fortis. They had a different guideline. Max had, but there was a common platform, and all us physicians we follow that particular guideline, whereby we can predict which patient is going to get sick and which patient requires hospitalization. So this second wave has made all of us physicians get involved in the entire process. It's not just a critical care or a pulmonologist who's treating. All of us are involved in treating our patients. And the mainstay of therapy is you have to tell them that the disease has a course. The first 5 to 7 days has a course of fever. During this period of fever, if you do not have a drop in saturation, if you do not have excessive cough, if you do not have features where the fever keeps rising, then you don't need to worry. You can stay at home and monitor it. You can take all the possible precautions of not spreading to others. Unfortunately, this second wave caused more of cluster disease. So I have tried to treat all patients in the family at the same time. They all monitored their temperature. They checked their saturation with oxygen saturation provided. They checked out their cough if it could be managed with steam and everything. If in 7 days the patient is doing fine, you don't have to worry. But yes, if a person starts having breathlessness, has a drop of saturation below 92, if he has fever persistent beyond 7 days, yes, please, you get back and they can be managed with treatment. And all this treatment, we have been able to manage most of it sitting at home, trying to treat them with online consultation. If a person does not respond after this second line, that is, after you have given him a short course of steroids with monitoring, giving nebulization, all at home, then you talk about hospitalization. We had a tough time in between when we did not have any beds available, we did not have oxygen available. But I'm telling you, with the new guidelines which we are following, we are at least able to predict which patient requires hospitalization. And the timing can be done in a better way. And I think that is the one which has to be managed. And if, God forbid, we have a third wave, we have to follow the same. Panic is not the important part. There are people who get their blood tests on day one and they get a HRCT on day one. That is not the important part. Here, wait for that 5 to 7 day period. If you do not respond, please, I will also get the HRCT chest done. I will get their blood test done with all the inflammatory markers. If they are deranged, they will be put on steroids and treatment accordingly. But there's no need to panic. A lot of disease can be managed at home.
Taking cue from what you said, suppose a patient or a normal person having a mild chest pain or a stomach pain, should we wait for 2 3 days for normal medication, or he or she should straight go away to a doctor, keeping in mind the second wave of COVID or maybe the third wave of COVID, which is looming largely? We don't know about that. What's
I'll
your suggestion for that?
This particular time, the young people have been affected, and young people who have been affected, Unfortunately, we have lost quite a few. But what we have seen is the youngsters do not realize that this particular disease should not be taken lightly. This disease seems to have caused a lot of post-COVID sequelae. They have recovered from COVID, gone back home, and then had mishaps also. So early activity for them is something which they have to realize should not be done. The people who resumed their gym, they resumed their training, started running, all those things post-COVID should be avoided. But I still feel the mainstay of managing a pandemic is prevention. And for prevention, there is nothing better than COVID appropriate behavior. Unless you have your mask which is on, unless you sanitize your hands by washing for 20 seconds with soap or with a sanitizer, or you maintain social distancing, unless you follow these guidelines, whether you're vaccinated or otherwise, you're not going to overcome this pandemic. So prevention is going to be the mainstay of our therapy, our treatment. They talk about prevention is better than cure. It holds true now more than anywhere else in this pandemic. And that's what I would reinforce.
Absolutely. Prevention is the key word that you have said, Dr. Bhalla. And let me take this opportunity on behalf of APEC News Network that we are proud of doctors and healthcare fraternity, what they have done for the last 1.5 years, not only in India, but world over. And we salute people like Dr. Ajay Bhalla, their colleague, and all the medical and paramedical staff that you have been the frontline warrior and you have saved life during the last 1.5 year. Otherwise, this pandemic would have resulted in a lot of uh, sad stories. But hats off to you. So we as APEC News Network salute you and all your colleagues in your profession as well. Uh,
Thank you.
I'll come
Thank you.
to the vaccination part, Dr.
I wish
Bhalla.
more. I wish we could do more. Really, I really wish we could do more.
I know, but again, still, whatever healthcare fraternity has done for this for all of us, it needs a huge salute and kudos, and you deserve all of that. You and your colleagues and entire medical and paramedical fraternity in India and country over. So Apex salutes them. Coming to the vaccine part, uh, what will be your suggestion for regular patients who comes to you that should they go for vaccination or should they wait till their ailment is cured? What your suggestion for that?
Oh, it's very clear. Again, like I said, good guidelines which are there, which we are following. Any person who is in the age group of 18 and above is eligible for the vaccine. But if a person or his family member has had disease, I tell them to wait for the disease to be over. For those who have had disease, 60 to 90-day period is earmarked. You cannot take the vaccine before 60 to 90 days. For those who haven't had the disease, you can get your antibody levels done. If you already have the antibodies, probably you had the asymptomatic disease from your family member. So I don't recommend it to them either. But for those who haven't had the disease and who haven't had vaccination, please go ahead. This vaccine is effective, is definitely effective in lowering the severity of disease. I can even tell you, I can quote you figures from our institute that we had almost 1150 healthcare providers who were there who were vaccinated, and almost half of them got the disease, unfortunately, after the vaccination. But only 10 of them required hospitalization. So out of 1150, if only 10 required hospitalization and only 2 of them had severe disease, definitely the vaccine is effective. So I cannot say that there's this part that this we took Covishield, which is the Serum Institute vaccine, and we took it in 4 weeks, the old protocol of 0 and 4 weeks second dose. But still the efficacy is there because the severity of disease was less. So I recommended that anyone who is eligible above 18, please go ahead and take the vaccine. Of course, there are some contraindications which your physician will be able to guide you, but please go ahead. Any form of vaccine is effective, whether it's Covaxin or the new Sputnik or whether the new vaccines come in, all of them are effective.
Dr. Balla, let me inform you that we are live in Facebook, YouTube, and Twitter through our APEC News Network channels, and a lot of people are watching it. I just got a message saying to ask you that you talked about that everybody should go for vaccine, but there are cases also. very few cases compare in entire India and world over that we have seen cases that some of the people who have vaccinated twice, first dose and second dose, but they have succumbed to COVID-19. So what's your thought on that?
These
To
are
get
people
the apprehension.
These are people who got the disease while they were they had not got the antibodies after the second dose. It's like when you receive a second dose on Monday, supposing on a Monday, and on Tuesday they started having fever. Now, this did not show the ineffectiveness of the vaccine, but it meant that maybe 10 days prior to it, they were exposed to COVID. So these are the people who ended up having a severe disease. For those who have had two doses and they've had, a period of 4 to 6 weeks, who probably have adequate anti-spike antibodies, they did not have severe disease. And those who did have a longer period, we have lost a few of our colleagues, and who did receive two vaccines and yet succumb to it, are those who had poor immune function. I can't name, but they had poor immunity and they did not have effective antibody response after the vaccination.
So
So
are you
those
suggesting that if someone have poor immunity, they should not go for vaccination? That's what you're suggesting.
always talk about it. When we talk about poor immunity, it's people who are receiving immunosuppressive therapy. If a person is receiving medicine which lowers the immunity, in a lot of cases, like in my field, we have IBD, inflammatory bowel disease. These are the people who will not generate adequate response. So these are the people where we say, okay, do not take it. It may not be effective. Or even if you take it, it's not going to be so effective. So you have to follow CAB, you have to follow COVID appropriate behavior. That is the keystone of managing this disease in these people. Because we do not have anything like what we call as, a totally 100% effective vaccine. These
Right.
vaccines have given a permission under emergency conditions by WHO and by the government of India here. So it's not that they are purely effective. But yes,
So
I would still
it's
say
basically like these vaccines are like building a shield on emergency basis because this is not a kind of vaccine which we have seen since many years that you take this vaccine, your child is safe, and but this vaccine is more of a precautionary vaccine to create a shield between the COVID and your body. That's what you're trying to say, right?
it is something like, the efficacy has always been there, talked about that it decreases the severity of disease. It may not be able to prevent the disease, but it definitely decreases the severity of disease. Rest is like up to your own immune function, but yes, it will definitely decrease the severity. But that doesn't mean that the moment you have a shot, you go around partying and your mask is down. The problem arises there. Our second wave happened because of this. People may blame the government policy, but actually it's the people who let down their guard. If you had not let down your guard, you wouldn't be having a problem. Do not have get-togethers. Do not go for parties. Don't let your mask down. I saw movie halls where people were making queues. There were people going for evening outs. So all those things, these are the ones. Now again, as the lockdown opens, I think mainstay will be to really follow this COVID appropriate behavior. I hope and pray that Indians have become wiser after this very bad second wave, where we have lost too many people. As I said, and I was talking, I wish we could do more. I wish now people learn a lesson and really, really are strict. Wait for September. By September, the metropolitan cities, I think, will have their vaccination completed. Wait for December. Most of India will be vaccinated. Then we can start talking about, celebrating, not before that.
Right, right. It's a very important point raised by Dr. Ajay Bhalla. Dr. Bhalla is saying that please maintain COVID appropriate behavior, even if you've taken first dose or second dose or both the dose together, at least till end of this year, because we have seen the enormity of the second wave of COVID, what it has done in this country. Let's not make those mistakes as a citizen to make the third wave more deadlier. Uh, Dr. Bhalla, one of my important question to you will be that what is the future like? even if the entire country or the most of the population of the country is vaccinated, two doses, do you still think that there will be chances of this another wave of coming to India? Because why I'm asking you this question, because we have seen the cases of other countries, European countries or US or some of the countries in Asia as well. They're saying that if the entire country is vaccinated, you don't have to wear mask, you don't have to maintain any COVID appropriate behavior. You're free to lead your normal life. But in a country like India, even if the most of the 130 crore plus population is vaccinated, what will be a suggestion for that? How to come back to normalcy, but keeping in mind the threats of this deadly pandemic?
This virus, as you know, has been undergoing so many mutations, and you are coming up with the UK strain, the Indian strain, you have the South African strain. There are lots
Hmm.
of these around. Now, this virus per se is something which has been able to survive extremes of temperature. It's a strong bug, so I would always treat with caution. I would really recommend that even after vaccination, it would be a period where you will have to keep yourself on guard. You will have to probably maintain some kind of a different lifestyle, whereby you keep a cautious guard about this virus. We do not want another bug to come again with a stronger wave. But the other side is, the positive side is, if 70% of the population is vaccinated or has got the disease, you get what's called as herd immunity. Once herd immunity comes, this bug may come like the swine flu, which is like a seasonal time. Once a year, it will happen every year. And then you would keep requiring the vaccination every year to prevent it. So that's the other side of it. So one part I
Are you
would say,
sure that we can ensure herd immunity in a country like India?
herd immunity will happen. It will happen because of the sheer fact that the number of people who have been infected by it. I would say currently also, probably with the second wave and the first wave combined, more than half the Indian population has got the disease. So it's not so that we are close on to it. We are probably closing on to 70% anytime. And vaccination will help. But at the same time, like I said, you need to be cautious. This bug grows in your airway. It doesn't survive outside that much. It stays in your airway. And the airway, one part is what's called the dead space from the nose up to the throat, where it doesn't enter your lungs because you've got immunity, you've got vaccination. But you can spread it to others. It is there in your airway. Despite the fact that you have immunity, you can spread it to others by talking or by sneezing. So you need to let this bug get out of the country, get out of this world, and then come back to normalcy. So I would still exercise caution, maybe beyond December also. I would say next year, June, and then thereafter, you can definitely let your mask down.
So maybe mid of 2022 or end of 2022 be in a safer side. That's a very important point expressed by Dr. Bhalla. My last question to you will be that, coming back to your specialization, so people who are having those kind of problem, gastrointestinal problem, what will be your suggestion for all of them before we wrap this edition? What will your suggestion for maybe the aged people who are coming to you, mid-age people, or the younger lot below 20? So, what will be your suggestion for them?
I actually had pointed. I thought this would be the first question, but there's a difference which I would say. I wouldn't go by age wise, but I would go disease wise. First and foremost, people who have COVID, if they have GI symptoms, do not overlook it. You probably will be having a severe disease, so exercise that extra caution. Two, if you have underlying gastrointestinal or liver disease. When I say liver disease, people with cirrhosis, people with hepatitis, these are the ones, if they get COVID, they tend to decompensate, meaning it has been seen that the morbidity and mortality increases by almost 60% in these patients. So you need to be extra cautious. So extra cautious, how you can be, is by COVID appropriate behavior, by taking the vaccine. That's all, either CAB or vaccination. So you'll have to follow that part. For people who have low immunity due to medication, I have I've purposely, I have them on follow up. I've tried to keep them on minimal possible immunosuppressives so that they do not get the disease. So they should follow up with their doctors if they are on treatment because of their IBD. Tell them that they are in remission. Can their dose be modified? And it can accordingly be managed. And fourth is about endoscopies, which also is something done by my specialty. We do not do gastrointestinal endoscopies currently in COVID pandemics unless it's an emergency. Now, these emergencies are, we tell our patients that in case you're having bleeding, GI bleed, if you're passing black stools or having black vomiting, yes, you should come to the hospital despite whatever reason. If there is a food bolus which has got stuck in your throat, you cannot swallow, come to the hospital. If there are patients with malignancies who need to be diagnosed so that they could be treated early, we can't avoid the endoscopy. You should be doing it then and there. So there are some areas where you need to see the hospital, go to the hospital and see the doctor. Otherwise, stay at home. Stay at home, do online consults, try to manage things at home. Unless there is need, do come back. Your doctor is there. He'll take care of you. But that's what I want to convey.
Thank you so much, Dr. Ajay Bhalla from Fortis, Noida. And you're right that doctors are there, and for us, doctors are the another avatar of God, and we have realized that more than ever in last 1.5 year, not only in India but world over. For last 1.5 year. And thank you so much, Dr. Ajay Bhalla, for joining us for this special edition of APEC Dialogue India Fights Corona. And I would again like to thank you and the entire medical fraternity for doing the service for the nation, what you have been doing for the last 1.5 year. And I'll just take a cue from what you have said before I end, that we as a citizen should also maintain our responsibility. That is, please maintain COVID appropriate behavior and do go for vaccination. Don't let your gut down, because there's a possibility of third wave coming, and don't let your guard down. Do go for vaccination, do hear to healthcare experts, and do maintain COVID appropriate behavior. That's what Dr. Ajay Bhalla has been telling us for last half an hour. Thank you so much, Dr. Ajay Bhalla, for joining us of this special edition of APEC Dialogue India Fights Corona. Do take care of yourself, do take care of your family, and do take care of your patients, and do take care of your entire fraternity. Thank you so much. Good night.
Thank
Take
you.
care.
Okay, okay. Bye-bye.